Hello and welcome to Channel Hope Podcast, where we share stories each fortnight to inspire and help people channel hope through life's challenges. I'm your host, Rata Campbell. In today's episode, we speak with Professor Bev Lawton, Director and Founder of Te Tātai Hauora o Hine, the National Centre for Women's Health Research based at Victoria University in Wellington, New Zealand. A prominent and highly recognised women's health champion, Bev shares her dedication over the years to improving all facets of women's health, addressing inequity and avoidable harm issues, and her drive to get government commitment to a cervical cancer elimination action plan in this year of election. Tēnā koe, Bev. How's it going out there?
Right, I would like it to stop raining, but it's warm.
You are in Wellington after all, so it kind of is fitting. It's so wonderful to have you on here. 2025 Kiwibank New Zealander of the Year, companion to the New Zealand Order of Merit, which you were awarded at the start of this year, on top of your many awards and accolades. And I know that is not why you do what you do. Women's Health Champion. How does it feel to have these accolades sent your way?
It's all a team approach, isn't it? You feel as though you shouldn't be on the seat. But what's really struck me is the number of people have come up to me and they don't know who I am, and they say thank you for women's health. And it's really struck me that women's health, we're all feeling out there that we've got some things that need to be done. I think it's a strong message, and it's all about what we've done, not about me, and it's about women's health. And I think people need to listen to that. Women's health is really important. How do we get cross-party consensus on women's health, on the things that matter?
100%. We are the future of humanity. Like, there's no way around it. So obviously our tāne are very important too, but women's health, you've dedicated your life to ensuring we get better care, we get better prevention. Talk to me a little bit about your experience with cancer in particular and why you're so passionate about that.
Well, it's interesting. I was looking back to when this all started, was probably 2010, way back when they had a vaccine for human papillomavirus. I'm interested in science. When I'd started medical school, I didn't know that this virus could cause cervical cancer. And only recently do we really relate it strongly to oral cancer and anal cancer. The science fascinates me. The innovation fascinates me. And that you could take little steps and make a difference. The fact you can combine vaccination and screening and treatment, and you can prevent people dying of cervical cancer. That's pretty exciting. Imagine if we can get that together with other diseases. And we can. It makes a difference. But it shouldn't be so hard to make it happen.
No, you're right. It shouldn't be. And, you and I met very late in the piece. Like, it's probably only been about 2 or 3 years that we've had some semblance of a relationship. And, oh, what a blessing. Like, for me, going through cancer treatment with our boy, which I mention in pretty much every podcast at this rate. But, that was the catalyst for wanting to see what's actually going on in this space, because a lot of whānau we met along the way, we realised there were genuine equity issues with people being able to access treatment, being able to make travel, all kinds of issues. But the more I dug, I realised it's much bigger than that, and that women is health. There's a lot of things that could be solved or close to being solved that you in particular have been at the leading edge of here in New Zealand, but also, Australasia, worldwide. It's all research and evidence-based mahi that you're doing. Talk to us a little bit more about some of the, the achievements that you've made in this space.
What you said there was evidence. You see, we should be, as scientists, be able to do, as doctors, get the evidence. We got the evidence that, guess what, people like self-testing. Is that a surprise to you, Rata? They like doing their own tests.
Seriously, I can understand how this has opened the door for more wahine, more women to actually even want to participate in the first place, which is important.
So, we've got the evidence, we've got the science, and surely that's policy. As you know, from all the people that have been involved in this, Rata, big teams of people, there had to be a huge segment of advocacy. I've been thinking a bit about this. That advocacy shouldn't have had to happen in a way. There's nothing ambiguous about the science here. I don't think in my lifetime you could come across something so good. Polio vaccine, no polio. Measles vaccines, no measles. The other one that fascinates me is rhesus babies. We don't have them anymore. So the science on this is very good. So why didn't we just slip it into policy?
I think having worked in this space with you, now. My eyes have truly been opened to how much the economic benefit has become far too big of a concern, and human life is weighted against that. Do you feel that's the case with many of the things
I'm
you're
not
working
going to
on?
disagree with you, but every cost analysis, benefit analysis to do with HPV and eradication of cervical cancer was positive, and the same with
Great.
the vaccine, which is why the vaccine went round the world within 2 years. So, I mean, the evidence was there, but I wonder, Rata, if that's, again, women's health, and that maybe we're waking up to the fact that we need to put the evidence forward, make it happen, and why do we have to have the advocacy? And we need to have women's health. Anyway, I don't understand it, but the job is not quite done. The job might be done in the next few years, but we're hoping by about 2035 we'll reach the right levels, reduce our cervical cancer down to elimination levels. We need women on board. We need everybody to be on that waka to say that this is a good idea and I want to do it, but we need to have the resources to do it, and it will take resources. Women are important. Average age 41. Take that woman out of the family, out of the whānau. The economic costs of that is high.
Also, as you mentioned, there's a number of other cancers that aren't unique to just women that HPV vaccination can help prevent. So really, it's a human cost that we're having to weigh this against at the moment, isn't it?
There's 400 cancers per year, our head and neck fellows tell us. 400 cancers every year in New Zealand from HPV. How do we start that discussion to move along from
Yes.
cervical cancer to the benefits across? Not only do we talk about screening and we have the HPV vaccine over there, we're not even integrating that. And now we're starting to talk
Yes.
about head, neck and anal, which is really exciting. We get a lot of bang for our buck from getting rid of this virus.
I guess with cervical cancer then and mention of these other cancers, is it kind of like more of a sexual health issue that we're also addressing here?
Oh, now that's a good point. I don't kind of think of HPV as sexual health because it is a sexually transmitted disease, but it's so widely prevalent. It's like everybody's got it. Like we've got bugs on our skin, that you're going to come in contact with it. Is it helpful to call it a sexually transmitted disease? Is that an enabler? Is that a barrier? That's the whole debate. Do you call it HPV vaccine or do you call it an anti-cancer vaccine? You wouldn't give an HPV vaccine if you didn't want to prevent the cancer.
Just the very term now, which is sad, but the very term vaccination, since pandemic times, it's become a challenging thing to even use that word anymore, which is frustrating because it is what it is. But immunisation, at the end of the day, it's really about building up our immunity. Vaccines or immunisations enable that. It's got to be a good thing. And as you say, it's all evidence and research-based stuff that you're advocating for, right?
That's a very good vaccine, this HPV vaccine. We've talked about see a study. I think this is an amazing vaccine. I mean, the women and young girls in Scotland who got vaccinated have got no cervical cancer compared to the group in their class that weren't vaccinated. The years have shown it's a very good vaccine. And I like that because I get excited by the science. The first time I saw, there were two very major studies on it. I immediately offered it to my children. And I paid for it because it was such a good study and it showed it was so effective.
Do you look to the Australian program like for ideas or for guidance or what works well and what may not here?
Well, the Australians have shown a lot of leadership in vaccination and in screening, and they're ahead of us. So in 2017 is an advantage because they managed to save more lives than we did because we didn't start to 2023. So we had 6 years behind. And I keep thinking how many women got cancer that didn't need to. But yes, we've had some wonderful Australian expertise on our committees for our trials. We've been able to get some hardcore laboratory science. We've been able to follow what they're doing and learn from them. And it's been really good. And we're still working with them. And they are world leaders. We are doing really well in screening, I may say, because we're
Yes.
offering everybody HPV self-testing. Although that's available in Australia, it didn't start off like that. We're the first country to start with high-income, universal HPV self-testing. And so we're actually ahead of them with the screening. They're doing a lot better on the other pillar, which is vaccination. So we're actually getting some of them to come over to see us. We want to learn from them. They really shared and been very generous of their expertise and time.
As are you and your team. We were just talking about this, weren't we, about your dedication and your persistence in this space. I mean, I've seen it for myself, and just knowing how long you have been trying so hard to lobby, advocate for change, not just in cervical cancer. You know, everything you're working on, you are very, very dedicated to, and you persist despite the resistance you seem to get.
Well, if the science is there, and if what you're trying to do is supported by women, by the evidence, well, we should. And I just get thrown over the wall by the team, you see, but they're all there backing us, and that team can be across government, across the colleges. As you know, Rata, a lot of people are on this waka, and I just happen to have got a bit of a name for the waka, but I'm not a very good steerer, and I do fall out of canoes often. So
no, not at all. You've done such an amazing job, and it's a huge waka to steer, and it's actually wonderful that you've allowed people to jump on to help, paddle it forward. Because that's a challenge too, to relinquish and enable and allow leadership in this space. There's a lot of great people that you've been able to pull onto this waka. The people that come to mind are your team, in particular at Te Tātai Hauora or Hine. Is it Wellington, Victoria University?
In the place where the sun shines sometimes.
Sometimes, yeah. Oh, I love windy Wellington. It's a great little town. It's a great, it's not a little town, it's our capital. What a wonderful thing to establish. 20 years that you were celebrating. How did it come to pass that you established it in the first place? What happened that led you to head down that path?
To do research. It's interesting. I suppose when I was in primary care, I knew that there were questions. There were questions about why some of my patients were getting different care, particularly if they were Māori compared to, if you're a white male lawyer, you're going to get fast-tracked to cardiovascular compared to if you're Māori. And I learned that by looking. And obviously the literature tells us that there was a differential of treatment for subgroups versus others. And so I was interested in women's health. Obviously I was interested in some of the questions that were really important at the time. I was doing a lot of women's health. I was doing menopause work. I was doing hormone work, and some of the biggest questions were whether everyone should take HRT and what were the long-term risks and benefits. So I started a study on that with some funding from the British Medical Research Council, and of course then that was blocked by the WHI. So there were a lot of questions, the Women's Health Initiative, which said, so HRT, we shouldn't give it to everyone. It's appropriate for some. So there was all those issues that were related to my clinical practice and the science.
Yeah, the menopause thing, I'm having to look into this. I'm not embarrassed to say it because it is what it is. That's the point. This is normal for women. It's a normal process, natural process for women to go through. It's great to hear that you've had that experience in that space as well. And prior to that, 17 years as a GP, did you see and experience a lot of things there with women, children, babies that also inspired you to research to make things better?
When I first started medicine, I'm not going to share when that was, a long time ago, there wasn't a lot of emphasis on women's health. You can look it up. And also, internationally, women weren't in trials. They were barred from trials. They couldn't participate in trials until I think in the States, they changed that in the 70s. I mean, only white people were involved in most of the trials. And so we had to make rules. I'm looking at what they've done in the Office of Research on Women's Health and Minority Health. Some of those early work they did was really leading. You need to they weren't able to get grants unless they had women or they had minority groups. I don't even like to use the word minority group, but they're not all the same group. They just assumed that it worked for men, that it would work for women. And we know that's not true. The people in charge in those days were men. And that's when you come with the differences, you see. If you look different, they treat you differently.
So was that what inspired you to really, get that rigour of research to be able to go and challenge these, the status quo?
I like the science. I'm an issue-based person. I'm not afraid to stand up for the evidence and gather the evidence. I like doing the clinical trials. I like asking the questions.
Yes.
Is this acceptable? Because, for the HPV self-testing, we needed to provide the evidence that it was acceptable. Gosh, I could go in a room and ask people, would you prefer to do a speculum or a self-test, which is what I did when I was exploring what to do in that respect. When I go and do talks about something else, I'd say, by the way, would you prefer? I had the swab. I had a swab all the time. I've been carrying the swab for years.
Well, it's like your speech wand. You can talk to people all about your knowledge in this space. The first time I tried it as well, the actual self-test, a nurse told me anecdotally without missing a beat. She said, "We've had many more people come in willing and happy to do the self-test. And of course, with that comes more knowledge, and your detection rates can go up because obviously you're testing more people. So how is that being managed as well? And is that part of the action plan that you're hoping to develop? Are you good in your wand?
I feel good now. I've waved this for I don't know how many years. When I first looked at the science, the fact the self-test was just as good as your clinician doing it, I thought, this is exciting. And so I used to go and talk about other things in forums, and I'd say, I want to take a survey. Put your hand up if you'd rather do this rather than this speaking. Every woman said yes. And I started first when I was in the National Cardiac group, and I asked my fellows, they were my group that got me going. I said, what do you reckon? And you know what? They thought it was a very good idea. That was a long time ago. That reaffirmation that this is something that we want as a community, and the science is there. And I think we
Yes.
don't want cervical cancer. We don't need cervical cancer.
100%. We don't need cancer, period. I mean, I was lucky enough to be working alongside you, when these things were coming to pass, and being able to support that process with you, which I have to tell you is an absolute honour. I know you don't like the accolades. I know you don't like being praised. But seriously, come on, Bev. You've done some pretty amazing things in your time, you and your team. What are some of the proudest moments that you've achieved at Te Tātai Hauora Hine?
Well, I think it's the growth of the group, fantastic researchers in the group, the fact that, they're able to say what they want, and they'll step up and say, can I help? Although I should yell down the corridor for today's work, but they might all just disappear. But no, they're all on the waka, and I think that's important. And I must mention the university. The university has been very supportive, and it really
Yes.
is, I call it the policy university. We've been at this university now for 8 years or so, and very supportive. So they let us do the work we need to do. And we would like to do more. We're a big group. We have a lot of help and support for our tikanga from kahui kaumatua, and that's important. So that te ao Māori, all those sort of things in community it's wonderful. So what are our
Yeah.
achievements? I think it's the group, the research capacity building, and obviously the things we're able to do. And we try to unpick systems, obviously delivery and systems and clinical delivery, which is a system thing. How can we make it easier or better to reduce avoidable harm? And it's the ultimate, isn't it? Using innovation to reduce the avoidable harm of cervical cancer.
I see you've got some really strong young wahine coming through your ranks as well. I'm thinking Kendall Stevenson, is it? I know them well enough because, you get around the speaking circuits and some of these conferences, and there, again, it's just that really strong evidence-based kōrero that you guys are out there advocating and evangelizing for change in this space. And it's so important for wahine women here in New Zealand. I know the cervical cancer kaupapa is your big one at the moment. There's been talk about developing an elimination strategy, and I know the government are looking into, this right now. But what is it that you actually want to see or would like to see happen?
They are promising us a strategy. Do we need a strategy, or we need to get and do it? I mean, it's not as if we don't know what to do. The WHO is telling us what to do. Australia's a good example. We are doing really well in one area. We're doing poorly in our treatment. We've not enough colposcopy clinics, all the things we knew would happen. We've had double innovation, really. We've introduced an HPV test looking for the virus. We know we'll find more abnormal cervixes. We know we need more colposcopy. And we knew that the rate would go up by about 1.8 times, and that was not catered for. Over many years, there was a lot of information, a lot of pushing for that, and didn't really occur. And so we brought in the innovation of HPV. We can find more people that need to be treated. But at the same time, we brought in self-testing, which more people were testing. And more
Yes.
people testing, we found even more. So it'd be interesting we look at it. We might actually find our colposcopy rates are more than twice now. And we need to look at those figures, and we need to tell other people so if they're planning to do this. But there are ways around this, and that's what we're pushing for at the moment. And there has been little areas where people have been able to manage this, and the government has given more money into the systems. But again, I mean, why? Why do we have to stamp our feet?
Very true. I mean, but essentially you're saying that you know what the solution, how to do this, get this done. The pathway to a solution are already there. So you're looking for an action plan effectively, aren't you? Rather than strategy.
It's just doing it. Pay the money for the nurses, pay the money for the colposcopists, get it done. I mean, if you have an abnormal HPV 16 swab that's done, it's come back positive, and they tell you have to go into a colposcopy. It's really important. But yet they don't give you an appointment for 1 month, 2 months, 3 months. If it's not important to them and not see you in 3 months, it can't be important for me. So if my kids are sick, maybe I won't go, or I can't go, or I've moved house. So there's lots of things which are more blaming on the system because you're telling them it's an urgent appointment. And if you've got an HPV 16 or 18, you might have a 20% chance of having a cervix that needs treatment, not of cancer, but of a cervix that needs treatment, which is great because that saves you getting cancer. This is something that needs to be fixed within the next 6 months to a year.
There's some targets, right, that New Zealand has committed to for HPV immunisation rates. Can you talk us through what those are? And obviously that's going to mean we really do need to sort ourselves out.
At the moment we're running, they call it 90, 70, 90. So it's 90% vaccinated, 70% screened, and 90% treated in a timely fashion.
Yes.
And we have targets for colposcopy be seen within 30 days. We are not making that target in a number of regions. And not making that target means people are sitting around with abnormalities, if not cancer. So that's going to be the bit that's going to make us distrust the program. And that worries us. But the screening, I think we should shift to 80% because we're hitting 70% anyway, because we're fantastic. All of you out there are fantastic. Vaccine fail. So we've got 2 fails and 1 plus, really. That's the screening. And I think we can move us along. We've got a little task force of people who are interested. Let's just help government and help them with a pathway or any way that we can help bringing people together.
When you really think about it, at the end of the day, we're all just people. Government officials aren't experts in what you are. You're doing us and them in New Zealand a huge service by providing this information, the rigour of research and evidence. I know it's frustrating because you don't always get listened to, but your persistence has really come through and, the results are there, and we're all behind you for this cervical cancer elimination action plan. And you're doing great work there, Bev.
Thank you.
So I just wondered, because you're living in Wellington and you've been there for pretty much all of your life by the sounds of it. I mean, it's the beating heart of our political, centre in New Zealand. Is that what keeps you there?
I think Wellington is great. I do worry about people. This is a different topic completely because a lot of our public servants aren't living in Wellington.
Right.
And they live out of town and people Zoom and they work from home or they work in another property. I think it's really important to be near the decision makers. And I'm quite happy to be proven wrong. But to us, it's a case of sitting in a room. I'd rather sit in a room to talk about the evidence because you can't do everything on Zoom. It's really hard, really
that
hard.
Interpersonal touch really makes a difference, especially when you're trying to, not just convince people, but take people with you on the journey that you're already on. You have the knowledge. It's a hard thing to communicate unless you're right in front of people.
You know that. It's all about, for us, it's about relationships. I tried trustships and trust. You know yourself that we've called people up on Zoom and had people in the room to discuss a decision or to try and get the program a little way. And you know that having all that team supporting us has been really important. So, that's the way you get the experts together. And often we would use an expert from overseas who's saying exactly what we're saying, but that voice helps. But I think you should come and live in Wellington. I always worry about this working from home. I think it's harder to make decisions in a timely way.
No, good. That's fair, Bev. I mean, you're living it. The relationships thing is so vital, and that's how we're going to get ahead in this space. And look, it's working. We're behind you all the way with this cervical cancer strategy, Mahi. And it's been so great to have this kōrero with you today. Bev, no, we'll be seeing you very soon, and I hope to come to Wellington for the next meeting.
That'd be great.
Please pass on our regards to your team at Te Tātai
I will.
Hauora Hine for all their great work.
So, ka kite.
Thank you very much for your time.
For more information about today's guest and the topic we discussed, check the description box for this episode. Join us again soon for more extraordinary stories from everyday people, shining the light of hope for others to follow.